hope you won't ever stop, okay? All right.
Thank you so much.
So you're welcome. Welcome everyone to our information session. We have about 25 minutes to get this information out to you. If I'm going too fast, feel free to contact us and we can make any clarifications. I believe you're also able to put questions in the chat box. So if you have any questions, I'm assuming, Carla, that you have a format for us to do that towards the end somewhere. Or during the presentation.
Yes.
So my company is Living Well. We provide counseling, training, and consultation in the Central Florida area, but of course we also provide training nationally and internationally. We have it's a community-based agency, behavioral health agency, where we provide in-home, in-office mental health services such as individual, group, family. We also are very engaged in the community for advocacy and social change. We also provide organizational training and consulting. So it is my pleasure to be a part of this process here today. Because this is kind of goes in line with what we do and the services we provide at Mental through Living Well. So when we talk about sickle cell disease, we want to look at the whole person, not just the individual that's experiencing the sickle cell crisis or the various changes that are going on in their bodies. But we want to also look at how it impacts that individual and how it impacts the entire family, right? So we know that generally, people living with sickle cell disease, it's a chronic illness and it affects us physically, mentally, emotionally, spiritually. We know especially people of color are significantly affected. And so it's important for us to provide education along the way because there's so many psychosocial impacts that sometimes are very much overlooked by providers that may not be informed or understand the varying aspects of the disease. And so people who have sickle cell disease may feel sad, they may feel frustrated, they can also manifest different ways in like the stress that they experience in different ways, which in turn will then affect the crises or the pain that they have, right? So as far as the family is concerned, there's a loss of income oftentimes where the parents have to be at the hospital, they have to take time off work, they're not able to do some of the things that they generally would do within the families. So as we talk about sickle cell disease and its impact, we're not just talking about what happens to that person. We're also talking about also what happens with the family as we look at the mental health and the psychosocial impact, right? So there's changes in the nature of the relationship. There's some times where a parent has to be removed from the home because they're in the hospital with one child. And so there's a loss of social connectedness with their children and also with other folks outside the home, friends and family. There's also a change in the nature of the relationships within, let's say, church family, the mosque, or within work relationships, because more is demanded of that parent to be with their child, right? And so for the person who has sickle cell disease, there's also changes that occurred, right? Where I guess before I go on to that, I want to talk also about a comprehensive care model, which is what I practice when I'm working with folks with chronic illnesses, right? We want to look not just at that individual sitting in the seat, but we also work with extended families. What's going on with mom? What's going on with dad? What's going on with the siblings that are in the home as well? Because everybody's impacted. So there's a sense that the individual that has sickle cell disease, okay, I'm in the hospital, I'm having a crisis, I'm having a lot of pain, I don't want to talk, I don't want to eat, I don't want people around me, I don't want people poking at me. So a lot of times our attention may just go to that one person, but in my approach, we definitely pay attention to the identified client, right, which is a person with a sickle cell disease, but we also look at the whole model, a comprehensive model of care, so that we can address all the varying aspects of their mental health, the individual as well as the family. So I'm happy to have the symposium be a part of that process, right? Educating, providing education, and so forth. Next. So examples, oh, you already went? Okay, thank you. So huh?
Like
I didn't know that you already jumped.
To go back? Do I go back?
So which one? I think you went one ahead, right?
Okay. This was the other one.
There we go.
Okay.
Okay. So let's open that up because mine is going. All right. So examples of chronic illnesses, we can. I think we kind of talked about that already. So you were correct. Keep going.
Okay.
All right. So the impact and responsive of sickle cell disease, right, is we have a sense of helplessness or hopelessness. We feel like, in general, the pain crisis episodes and issues related to sickle cell disease have worn us down, basically. So for people living with sickle cell disease can become confused. They can have anxiety, depression, feel helpless or hopeless. And so there's oftentimes a lot of loss and grief. Just prior to this discussion, I was informed that somebody had passed away. And so oftentimes not just their own mental health is because of what's going on with them, but also what's happening with people around them. There could be experiencing loss and grief. It sometimes affects sleep, where there's a lot of pain and fatigue that comes with it, and so folks have difficulty sleeping. They have difficulty coping with things that they normally would be able to go, okay, I can handle that, I can manage it, but when I'm suffering, that brings difficulty. So next, please. All right. So when we talk about sickle cell and mental health, there is a definite correlation in that when those that have sickle cell disease, and I'll just say warriors, okay, because sometimes I have different ways of identify them, but sickle cell warriors, because I get that from Carla. Sickle cell warriors, they face a lot in their lives and they feel vulnerable, and so there are times where they may develop resentment. They may towards their care workers, towards parents, towards those that are trying to help them, not because they're mean people or rude people, but because there's so much going on with my body that I feel so out of control and so vulnerable in this place that I have to get that out somewhere. So sometimes there's resentment, a threat to their own self-esteem, because there's this message that says somehow I am defective, somehow I have something so wrong that I am always in the hospital. And so they begin to believe this idea, and we'll have a diagram later on that kind of shows you that the core belief is I'm defective, there's something wrong with me, and that will always be wrong with me. And then I begin to look at themselves as less than and not worthy or not able, which part of that may be true. They may not be able to go out and run 10 marathons, but they are able to do some things. So when we look at the mental health piece, we look at that and say, okay, so there are limitations, but it's not all gone. There are parts of that we can work on and develop so that you are able to feel more able rather than less able, focused on what you're less able to do. So our warriors may feel vulnerable due to their chronic illness. So they may have a loss of energy and they may have lethargy that leads them to feel helpless or hopeless and not wanting to engage socially. When we look at poor mental health, one of the things that the symptoms worsen when you have crises, right? When you're in pain, and that pain leads to probably more depression, and more depression leads more to exacerbates the pain. So it becomes a cycle where people or the warriors are now in a pain, depression, or anxiety, more pain, and the depression can worsen the perception of their pain. And there are many researches that will show you that when you have added stressors or added pain, added depression or anxiety, it will exacerbate the perception of your pain. Now, we're not saying people are not feeling pain. Please don't walk away from here and say, she's talking about perception of pain as if it's not real. I'm not saying that. Any person, whether it's sickle cell or something else that is in chronic pain, even the very perception of pain, and there's research that supports this, will increase the feeling of pain. And so that's what I mean by the perception of pain, because the mind tells the body, here comes that cycle again. And so because you're in that cycle, the pain becomes more and more profound. So that's what I mean when I say perception of pain. When there is, as I talked about before, stress will trigger painful episodes. And so we want to minimize the amounts of stress that our sickle cell warriors are experiencing, because we know that will decrease the possibility of more crises coming on in the future. So what do? We know that the symptoms exacerbates, the symptoms of the disease exacerbates the mental health, whether you call it diagnosis or experience, the stress of treatment, the feelings of vulnerability, and the loss of control. I talked about that a little bit. A threat to self-esteem we talked about. And there's also the other part that impacts as I say, the greater part of the family. Like I have one child that says, well, I don't want to do that because I know my mom can't afford it. So teenagers now become more concerned about the financial weight that they're putting on their families. And also the parents that are involved are also having financial concerns, because there's more money that's going out every time there is illness, whether it's money spent because of hospitalization or money spent because mom or dad has to be off work, has to take time away, not making enough money, and so forth. So there are oftentimes changes in our family structures that folks that are sickle cell warriors are experiencing. One family member may say, okay, I've helped enough and I'm out, I can't help anymore. And then putting more weight, they may be the babysitter for a while, and now they put more weight on the primary caregiver, because now I have to find somebody else that will help with my younger kids while I'm at the hospital with my other child, and so forth and so on. There's also could be a change in the family structure where one of the adults in the home, whether it's their partners or not partners, that were once helping is no longer helping. So it's not just somebody outside of the home, but it could be the family structure in the home where dad gives up and like, I'm out, or mom is left to do everything on her own because maybe there's just tired of helping or just don't want to help anymore. And so resentment could build within the sickle cell warrior as well as the caregivers that are impacted. Next, please. Okay, we kind of talked about this slide already, so I think we can go on to the next. All right. So there are different impacts depending on the relationship that each of you have, each family member have with each other, right? You can have sibling to ill child, that we talk about that a little bit, adult children to ill parents, or spouse of the ill person, or parents of the ill person. So we talked a little bit about that, like there's an impact to the parents, the job, leaving other children. The spouse may want to be engaged or be more engaged or less engaged or not engaged at all. We have adult children who are also engaging in the care of the sibling who is probably younger and feel, you know, I want to help mom out, so I'm going to be more supportive, I'm going to be more engaged, I'm going to do more with the other kids at home while mom is away. So there's a different impact depending on the type of the relation. And you have other children that will say, I don't want to be involved. It's too much for me, and I don't want to be that person that is taking on all this responsibility, and I can't go out here and play with my friends, and I can't engage in the community as I want to engage. And so it's important for us, right, as mental health and other care workers that are helping is to look at all of these aspects of the relationship and to be involved in any way that we can be. So next. Next slide, please. All right, so this is the diagram that I alluded to earlier, and sometimes it can be a little bit confusing. But when we look at the pain experience, and we use cognitive behavioral therapy as a format of intervention when we're working with people with chronic illnesses. It's a research evidence-based protocol that has been quite effective with chronic illnesses. And so with the pain experiences, there's many different aspects that go along with that when you talk about mental health. And so let's look at the triggering event, which is the upper middle. All right, it's being in the hospital. Something happens, and then along with that comes the negative automatic thoughts. Those are thoughts that come in our minds that we cannot control. They just come automatically, and what we do with them is what determines whether or not we are going to walk through this in a healthy way, or we're going to walk through this in a more vulnerable way. So there, with that automatic negative thought, maybe here we go again, I'm going to be missing school, I'm going to be missing work, or whatever is happening. Then there's an anger or fear of rejection or acting out, which that warrior may begin to push people away from themselves because they're not feeling socially interactive right now. I don't want to talk. I don't want to be out of my room. I don't want to eat. I don't want to do anything. I just want to be left alone. So that may be the response. And then there's a potential threatening or stimuli, which is pain or complications that the doctors may be having at the same time. So all of these are impacting all these mental health issues, all these emotional pieces are continuing to impact the pain experience. And that's what we talked about, the perceived pain. All of that is now increasing the pain that sickle cell warrior is experiencing. And then there may be a hypervigilance or selective attention. I'm not going to focus on that, or that's all I'm going to focus on is the pain that I'm having. I'm not thinking about the other kids that are here that I can interact with. I'm not thinking about the nurses or the doctor telling me one number is up. I'm just thinking about all the pain that I'm experiencing right now. And there's then there can be fear or anxiety about, I won't live to see my dreams come true. Am I going to die? There are questions about that. So that's also those emotional mental health issues that are going on. And then they may begin safety-seeking behaviors, right? Helplessness is reinforced, where they I want to make myself feel better, right? I want to make myself feel better. And so I may start to do things that will help me feel better, whether it's healthy or not healthy. So those are some of the things that's a natural reaction when we're experiencing pain. There also could be passive coping, where there's prolonged rest or getting a massage, or, that's all that I need right now. I don't need anything else. I don't want the medicine. I know all the other stuff that I'm supposed to do, but I just want to rest and get a massage. And that's what I'm going to do to take care of myself. That's also going into that pain experience, because if you're not doing all of the different parts, right, you're not getting the best out of your treatment. And so we're almost towards it. So then there's the automatic thoughts that are reinforced by the family dynamics. You know what? My dad hasn't come to see me in the last week, so maybe I am defective and I'm not worth anything. Maybe there is something wrong with me. Maybe I'm not lovable. So those automatic thoughts are reinforced by behaviors that are going on around that sickle cell warrior that's the identified patient. The depression also is a part of that. My pain is going to last forever. Acting out, isolation, vulnerability factors, the early experiences of sickle cell disease is from 6 months on. I've been vulnerable. I've felt vulnerable, that there's something that needs to be fixed within me. And then there's a core belief that's developed that I am defective. And as you see, those are always that cyclical thing happening here. And if you look at the place where anger or fear of rejection, that goes back to that core belief again. So what we see in therapy, that we have to address all the different parts here in order to help to reduce the pain experience. So I hope that explains it a little bit about what we try to do when we looked at the psychological responses to pain crisis and experiences that the sickle cell warrior is experiencing. They're triggering events that will produce a myriad of emotional reactions, responses, and behaviors. And as the providers, our job is to be vigilant to address all of that. And we try to also help the caregivers, moms, dads, aunts, uncles, grandmas, also to be vigilant to try to address and engage the warrior about all of these different parts. We only have a few more minutes, so I'll go a little faster. Next, please. Next slide, please. Okay. So, so some of the consequences, I think we've kind of covered the consequences of repeated pain and crisis in sickle cell disease is fatigue and feelings of helplessness, hopelessness, sensitivity, right? And so I think we've covered that. We can go to the next one. These are some percentages about sickle cell and depression. We can move on to the next one. All right, so want to do the case study. Yeah, the case study is what I'm looking for. This is also another slide about suicide and anxiety. If it's about the contributing factors of sickle cell disease and anxiety. But I want to give you guys a case study that I think will help you kind of look at the whole person that we talked about, looking at the person's, and I want to give you an opportunity to give some answers also. So I'm going to read the case study about Marisha, and then I want you guys to kind of come in and give us some ideas of what you think we need to do to help Marisha, because there's a lot going on when we look at the whole, not just the warrior, but the whole system of care. So that's why we provide a comprehensive care format. So I'll go ahead and read, and then you can put your ideas in the chat and we'll take a look at that and fill in the blanks where we can. So Marisha was recently admitted to the hospital. She's 14-year-old African-American. This is her 5th visit since the beginning of the year. It's June and she's been dreaming of spending lots of outdoor time with her friends and family. She presented with irritability and isolation, withdrawal, sadness, and loss of interest in her care. She refuses to engage with the other kids on the hospital ward and continually asks to leave the hospital to go home. Her mother is a single and lives from paycheck to paycheck. She tells Marisha that she has to stay until her numbers stabilize. This angers Marisha even more. When encouraged to get to know the other teens in the hospital, Marisha is disinterested and responds with apathy. She just wants out of the hospital. She doesn't want to engage. She just wants to be at home in her own bed. Her mother has 4 other children under 14. Marisha's old.
Sorry,
Hello?
I think I was on a different one. It's talking about a African-American boy.
Yeah, I sent you one last night that updated.
Oh, okay.
I think it's in the wrong one.
Yeah. Okay, you can just read that one in.
So could you just move on with that?
Yeah. You can read that though.
Just take it off of that one. That one's gonna confuse. So we'll just leave it on the next slide.
Okay.
All right. So apathy. Her mother feels sadness, anger, and hopelessness that Marisha feels and finds it difficult to force her to make friends or engage in her care while in the hospital. Instead, she uses her time spent with Marisha to show affection and love, support, and care. She encourages her to engage with the family and friends via social media, TikTok, Facebook, but she's inconsistent in doing so because of her depression. Mom sometimes stays at home with the other children because of their complaints that she's never available and always at the hospital. So Marisha grows increasingly distant with her medical caregivers, her parents, her mom, and appears disinterested in working with them on her care plan. So mom questions when Marisha will be going home because she sees that Marisha continues to decline and she continues to ask daily, ask mom daily, when am I going to go home? So there's pressure on mom. This feels overwhelming to mom, and she's navigating her child care and trying to take care of the rest of her family. And because of this, mom has added pressure because she's missing work, added pressure from her other children, financial needs are waning, and her own mental health is at risk. So she works daily and only has a few hours of work to spend with her children. Marisha's father is infrequently visiting and is mostly uninvolved and distant, and mostly interested in his new girlfriend. Marisha has also overheard discussions about the rising cost of the hospital bills, and so Marisha feels responsible for the financial struggles that her family is experiencing. So how can we help Marisha? So what comes to your mind when you hear this case? You know, what are the things that you think we can provide Marisha to help her, to help this family? So how will we do this? Will we just, can I see the chat too, Carla?
Yes, I think you should have access to the chat also, be able to see it.
Because I don't see.
I have a suggestion.
Sure.
Okay.
I know that when I was frequently back and forth in the hospital, I would say to integrate some of the things that she has attachment to at home, like little things like maybe a comforter, or maybe a stuffed animal, or a certain trinket that she likes at home, and bring it with her to the hospital for comfort. I know that certainly helped me when I was younger.
Yeah, that's a good one. That's a good one. Is it okay, Carla, to go ahead and just say it?
Yes.
Because I can't see the chat. Okay. So if you guys want to share, just feel free to speak up. Thank you, Twanice. That's a great idea, actually.
You can unmute if you need to share. We only have 1 more minute.
Miss Ebony asked if Marisha has a mental health counselor.
What was that? All I heard was mental health counselor.
She asked if the patient has a mental health counselor. Miss Ebony asked that question.
I'm sorry. Could somebody else say, because your phone is breaking up, Twanice. I don't know. I didn't.
Is that better? Can you hear me now?
Something about mental health counselor. I can't hear the well.
Miss Ebony asked if the patient has a mental health counselor.
Oh, yes, this is the counselor's history that was taken from her, so that we're trying to assist her, but this is the entire case of what we have. She doesn't want to engage, doesn't want to be involved. So how can we help here? So provide counseling, I'm assuming, is what Ebony you're suggesting. That's a good one.
Reflecting on the positive things that's going on in the hospital.
Yes. So even though Marisha doesn't want to, mom can continue to, and the mental health provider can continue to focus more on what is going right rather than putting the focus on what's not going right. Yes. Anything else?
Ms. Ebony also says provide a safe environment for her to be herself, validating that she is actually understood.
Validating that she's actually understood. Perfect. A lot of positives. There's a slide that I have there, Carla, that says what helps. That's what some of the things that we have there is to identify, to help her see what is great about what's going on with her. So I hear what you're saying. I know that you're hurting, and that's a very real thing. We're not ignoring that. So it's important that we validate her, but also understand like there's another tough part, right, to surviving and to navigating the crisis, is that even though you don't feel like it, it is healthy to do it. So acknowledge that, validate that, says, can we take a break today and maybe go start again tomorrow? Or can we take a break in a few hours and then we'll try this one thing? So allow some rest, right? But at the same time, validate validate her, but we do also need to do this other thing. So doing both. So that's a great idea. I now see a chat. I have no access to mental health services despite bringing it up with my hematologist. Yes, that's one of the things that we have faced here in our area as well, where a lot of times that there are providers that don't think this is an important part. But there's lots of research that supports when you engage a mental health provider with with people that are, whether it's through individual group, support group, whatever it is that each individual needs, it does help. But providers aren't always keen to bringing that in. Carla, maybe you can talk a little bit about that. Do you have anyone that you, I mean, I do telehealth, and I know since last year, there's a lot of telehealth folks that will participate with mental health. So that may be a resource. But Carla?
Yes. I just definitely communicating through telehealth, and we have one of the services, I cannot, that does the bone marrow transplants. They're offering free therapy services also to the community that's impacted by sickle cell. So there are very important factors out there in organizations. But just because of the sake of time and we have to go to the next group, the next session, I want to thank Andrea for joining us and providing such educational information. Please chime in on the chat, and she can also, we have a Q&A section. You can put questions down there. So I thank you for joining this session, and we're going to get ready for our next session. This is very important to continue the conversation on mental health. And I want you to continue these conversations, and please connect with a mental health therapist if you need to. And definitely it's good if you're facing a chronic disorder. So thank you for your time, and we're going to continue to the next session. Thank you so much, Andrea Garwood.
Thank you guys for having me. I hope this was helpful to you. 20s, thank you for sharing, and Ebony.
Thank you.
Good to see you.
Good idea to also call your insurance and see if they have a provider, but they're free resources.